Hackers may have a new target in the new year. Medical devices like MRIs, ventilators, even pacemakers.
This makes me so angry. I can't even believe this is a possibility. A government watchdog issued the warning in a new report. Toby Goucher is an executive at privacy and security firm First Health Advisory, joining us live to talk more about the risks and possible solutions. That's the important part of all of this. Welcome. Thank you for being here. This is just unfathomable. Can you tell us what the goal is? What are they doing and why?
Well, malicious hackers, whether they're nation state or, organized crime, are really interested in finding money. Okay. And so you've seen a lot of hacking going on in healthcare with regards to ransomware attacks, et cetera, shutting systems down. But there's really another Achilles heel, a weak link in hospitals, which is all the new medical equipment that's being attached to improve our healthcare also improves the chances that a healthcare can attack a system.
So, Toby, there is a new law requiring the makers of these medical devices to include cybersecurity software, but there are millions of machines already in use, and that wouldn't apply to them, right?
That's correct. That's the greatest concern. The new equipment is under control, but there are hundreds of thousands of devices that are not regulated by those new policies.
Okay, so let's talk about the devices that are most at risk, including at-home devices, because I want to make sure people are aware of this.
Yes, security researchers have already shown that pacemakers can be hacked, and that if you're on a dialysis piece of equipment, we've had a security researcher prove that he could hack his own dialysis equipment in the hospital. But larger pieces of equipment might be major sources of attack because they're the money makers for hospitals. MRIs, things like X-ray equipment, for example. X-ray equipment was hacked up in the Northeast a while ago, and people stole chest X-rays because they wanted to sell those on the black market. So there's lots of things that have economic value in healthcare.
That is awful, and life-saving implications too for some people, would you say?
Yes, absolutely, and that's one of the issues with regards to how you fix this problem, because when these devices are attached to human beings, it's not like typical cybersecurity where it's around bits and bytes and things that you need to fix there. There are blood and bone implications of everything you do with a healthcare medical device.
Well, and it seems like for quite some time now, we've had to worry about hackers getting a hold of patient records. That seems like they've taken this to an entirely new level. So at the end of the day, is there anything that we as individuals can do to protect ourselves from these new concerns, especially if you have one of these devices, or are we going to be waiting on the hospitals to figure out a way to help us out?
Well, I think that the best thing individuals can do is to help communications with their politicians, because hospitals are aware of this issue. They're just short on capacity and resources to do this. The public in the state of New York, for example, has raised awareness there, and the New York State Legislature is proposing a spend of about $500 million this coming year to help healthcare facilities in particular with cybersecurity concerns. So other states could follow suit.
Well, Toby Goucher, thank you so much for joining us and making our viewers aware of this threat, and hopefully it doesn't happen to anybody.
Agreed.
Appreciate it. All right.